Hi everyone. It's a big honor for me to introduce Dr. Gubarov. She goes by Dr. Polina. We all have nicknames. I go by Dr. G. And she joined our practice. And I've been talking to you guys a lot about different techniques, dental implants, full arch, smaller cases. But I'm honest about my skills. I cannot be doing everything at the top level. There are certain areas where I admit that there are people who are doing things better than I do. And one of those techniques, it's a tunneling technique. It's for gum grafting, and there are many ways of adding pink, and we're all about pink and white at ImplantWIDE. And without further ado, let me introduce Dr. Polina.
Hi everyone. So we just wanted to make a quick video talking about the tunneling technique. So let me back up a little bit before I get into the technique itself. So sometimes the gums around of our teeth can become really thin or recede, and that exposes the root surface underneath, and it can make the area look uneven, or sometimes you can have some sensitivity associated with that. And soft tissue augmentation is something we can do to thicken up that tissue, cover up the exposed root in some cases, and improve overall aesthetics. So there's plenty of techniques out there, but one that I enjoy the most is called the tunneling technique. So the point of the tunneling technique is that it's actually more minimally invasive. You make very, very small incisions in order to accomplish the same thing you can do with creating a larger, what we call a flap or a surgical procedure. You make a very, very tiny incision, which I actually can show one of our cases here. First, we're looking at see those two little incisions that are made underneath the recession or the exposed root. And I'm able to do the whole surgery through those two tiny little holes. What I do is we take some tissue either from the roof of the mouth or a tissue substitute, and we place it inside of that tunnel, which you can see is formed by connecting those two lines. And then what we get is overall your body will take that material, make it its own, and you'll get thicker, stronger, more resilient tissue, and it'll protect you from further recession.
It's all very impressive. You have amazing pictures and case after case, and I'm sure that our patients and referring doctors will definitely benefit from Dr. Polina and your skills. It requires finesse and patience, and obviously, periodontist by definition should have all those skills. But thank you. Stay tuned. Cheers. What do you want to say?
No, just we'll see you soon. Excited to meet everybody.